Type 1 hypersensitive reactions, anaphylaxis, and atopy. So first, hypersensitive reactions. Hypersensitivity reactions are defined any one of the following. Hypersensitivity reactions are excessive immune response leading to damage in the host. These are inappropriate immune responses resulting in pathological changes in the host. Inappropriate response to foreign substances are called allergy or hypersensitive reactions. Classification historically, these are divided into in a time basis. Immediate reaction. Reaction develops in less than 24 hours. Delayed reaction when reaction develops within 24 to 48 hours. Coombs and Gell's classification. This was given in 1963. AB dependent reaction, BL dependent. Type 1 anaphylactic and immediate reactions. Type 2 cytotoxic reactions. Type 3 immune complex disease. AB independent reaction. Type 4 delayed or cell mediated immunity. So type 1 hypersensitive reaction. Definition of type 1 hypersensitivity reaction. This is also called immediate hypersensitivity when an IgE response is directed against the antigens like pollens and leads to the release of pharmacological mediators such as histamine. IgE sensitized mast cells and produces an acute inflammatory reaction with SS like asthma or rhinitis. This type 1 reaction can range from a life-threatening anaphylactic reaction to milder forms associated with food allergies. Atopic allergy including hay fever, asthma, and food allergy. Here we could see hypersensitive reaction and the role of mast cell. IgE Fc receptor antigen bridging of two antibodies by antigen. Bridging of two antibodies by antigen. Mast cell degranulation. Type 1 hypersensitive reaction and the role of mast cell. And mast cell Fc receptor of IgE, basophil cell Fc receptor for IgE. Mast cell and basophil cell. This is also called an anaphylactic reaction. Anaphylaxis, harmful or allergic reaction. It has two presentations. Immediate reaction. This reaction starts within 5 to 10. Once again, immediate reaction. This reaction starts within 5 to 30 minutes and subsides in 60 minutes. Late phase reaction. This starts in 2 to 8 hours and lasts 2 to 3 days. The term allergy was used by von Birket in 1906, meaning the changed reactivity of the host when encountering the antigen on a second or subsequent occasion. Types of antigens. Characteristics of antigen or allergens. Any substance which gives rise to the wheal and flare and symptoms of allergic diseases are from various sources. When the substances are purified, they have almost all been found to be proteins. The molecular weight varies from 10,000 to 40,000 Daltons. These proteins are all freely soluble in the aqueous solution but have many different biological functions. Allergens example: heterologous proteins like antisera, hormones, enzymes, venom, and pollen. Polysaccharides, iron dextran gives severe reaction and comes under diagnostic agents like iodide and bromosulfophthalein. Therapeutic agents, drugs like antibiotics, penicillin gives severe reaction, and vitamins. Food, milk, wheat, fish, nuts, and chocolate. Insect venoms like bees and wasps. Types of antibodies. IgE is the main antibody and is called a reagin. It is cytotoxic AB. Once produced, it has low and affinity and attaches to high affinity receptors Ig epsilon R present on mast cells and basophils. IgE receptor Ig epsilon R consists of 2 alpha molecular weight, 2 beta chains. So type 1 hypersensitivity reaction and Fc receptor for IgE on mast cell or basophil. Fc receptor for IgE, then cross-linking will be taking place. The Fc receptor are of two types. High affinity is called Ig epsilon R1. Low affinity is called Ig epsilon R2. High affinity Ig epsilon R1 and low affinity Ig epsilon R2. Formation of IgE. Antigen stimulates BL with the help of antigen presenting cells and Th2. Antigen stimulates B lymphocytes with the help of antigen presenting cells and Th2. These activated B lymphocytes are transformed into plasma cells and produce IgE. 100 molecules of IgE are needed to initiate the reaction. Ig, APC, Th2, BL. Activated plasma cell IgE IgE persists up to 6 weeks. Formation of IgE molecules. Mast cell or basophil. Mast cell and basophil histamine release. Fc epsilon receptor for IgE. Degranulation occurs in few seconds. Heparin, histamine and heparin. Mast cells are and basophils release histamine and heparin. So IgE is a local response. IgE is a local response occurring in the entry site of the allergens. Locally produced IgE will first sensitize the local mast cells, and the rest of the IgE enters the circulation and binds to the Fc receptors on base. IgE is a local response occurring on the entry site of allergens. Locally produced IgE will first sensitize the local mast cells, and the rest of the IgE enters the circulation and binds to the Fc receptor on basophils and tissue-fixed mast cells through the body. The half-life of serum IgE is only 2.5 days, while mast cells may remain sensitized for up to 12 weeks. Then structure of Fc receptor. IgE level is raised in allergic disease and markedly raised in parasitic infestation. There is no transfer across the placenta. In contrast, IgG can cross the placental barrier. Type 1 hypersensitivity reaction. Antigen APC Th2 activated transform into plasma cell IgE. IgE fixed to mast cell or basophil. Normal IgE level, here you could see. Mast cells are found in around the blood vessels in most of the tissues, connective tissue mast cells. Mucosal mast cells are found in the gut and the lungs. CTMC from the peritoneum and the skin are different in the histamine granule, the density of the staining and the pharmacological functions. MMC is found more in the midgut and the lungs. Then in parasitic infestation, their number increases in the gut. Their numbers also increase in Crohn's disease and ulcerative colitis. Once the IgE bound to the Fc receptor on the mast cells and basophils, degranulation occurs by cross-linking the IgE antibody. The cells with Fc epsilon receptors are mast cells and basophils. They have IgE-mediated reactions to Fc epsilon receptor. T lymphocytes have about 1% Fc epsilon receptor. B lymphocytes, monocytes, eosinophils, platelets. There are mast cells in the tissue and basophil in the blood. Mast cells are of two types: mast cells in the connective tissue, mast cells in the mucosa. Role of T lymphocytes in activation of B lymphocyte and formation. IgE production depends on the T lymphocyte, which activate the B lymphocytes and produce IgE and IgGF. Stages. Hypersensitivity 1 reactions are: first stage. This is the stage where there is sensitization of host and formation of IgE-AB, which once formed attaches to receptors on mast cells or basophil. Second stage. This is the stage of reaction or shocking dose. In this stage, where patients will have histamine effects and called histamine poisoning. First, exposure to pollen. IL-4 activates BL to produce IgE, which fixes to mast cells. IgE fixed to mast cell. Second, exposure, degranulation and develops allergic reaction, release of chemical mediators, signs and symptoms appear. Stages. Type 1 reaction has 4 stages. Activation of the B lymphocytes to produce IgE. Antigen and IgE will sensitize mast cells. Mast cells release chemical mediators. The patient will have SS like asthma, hay fever, atopic eczema. AG and AB bridging leads to degranulation, where AG makes bridging between two IgE-AB molecules present on the mast cells or basophils. AG and AB bridging, mast cell basophil. Degranulation is an active process where there is an influx of calcium. Initially there is a rise in CAMP and later it decreases. Leads to release of primary mediators, secondary mediators and cytokines. Chemical mediators of type 1 hypersensitive reactivity reactions are primary or preformed mediators like histamine, ECFA, eosinophilic chemotactic factor or anaphylaxis, neutrophil chemotactic factor, serotonin. Secondary mediators, arachidonic acid metabolites, slow released substances of anaphylaxis and now called leukotrienes. Platelet activating factor, prostaglandin. Histamine clinically leads to wheal and flare, bronchoconstriction, increased mucus secretion, hypotension due to vasodilation and increased vascular permeability, cardiac arrhythmia. Then histamine target areas show skin edema and hives. Trachea and bronchi due to bronchoconstriction lead to asthma and increased mucus secretion. Eyes and nose increase secretion and red eyes. Genital smooth muscle contraction leads to abortion and pain. Gastrointestinal tract. There is nausea, vomiting, abdominal pain and diarrhea. Leukotrienes, platelet activating factor, prostaglandin. Clinically, anaphylactic reaction may be localized reaction, systemic reaction. Localized reaction, it causes skin allergies, wheal and hay fever, allergic rhinitis, asthma, atopic conjunctivitis and urticaria. Systemic anaphylactic reaction, this is generally a phenomenon related to nausea, vomiting, asthma, laryngeal edema and abdominal pain, diarrhea, low blood pressure and immediately patient goes into shock. It starts within a few seconds to 30 minutes. Late phase